So just a couple of weeks ago, I was attending placement at hospital as normal, and all of my friends and the other medical students were speaking about coronavirus because the numbers were increasing, and also because the hospitals that we are placed at, there were a growing number of coronavirus patients. But things were carrying on as normal, and then everything changed literally in like a day, and loads of posts started appearing on the medical school forum about how people had come into contact with coronavirus patients in the hospital, and things just started to like kind of explode. It was a very strange and surreal experience, and this is what happened.
Hi guys, I wasn't planning on filming today or anytime soon, but all of my classes today have been cancelled. Everything's just been changing very quickly, and we're kind of getting new updates every day, at least, on the situation with our placements and our education. Essentially, Monday, Tuesday and Wednesday, everything was fine and we had normal teaching. And then yesterday on Thursday, a lot of concerns started to get raised on our online forum for the med school. The problem, the concern is, as medical students, we travel between hospitals, we get on the tube, we use public transport, we go to libraries, we go to different events, we move around the city quite a lot, and then we come into direct contact with and speak to and examine people with chronic illnesses who are vulnerable. That just, to me, sounds like a recipe for disaster, but my university has not said anything yet. As of today, they're still recommending that we just go to classes as normal and go to wards as normal. Some people find this a bit strange because med schools all over the UK have closed, basically. They've stopped their clinical placements, but we're still being told to go in. I'm fairly certain that within the next few days we'll be told not to go in anymore. Anyway, that's what's going on with my medical school. I think there's a lot of misinformation on the internet. I think there's a lot of confusion, and I do not claim to be an expert. I'm not even a qualified doctor, but there's one thing which is just for certain. COVID is not the same as the flu, and I keep hearing this and seeing this, that it's just a flu. It's like a bad flu. It's not a bad flu. It is much more dangerous than the flu. The flu also has a vaccine, and we understand how it works, and it's just a lot more well understood. But I'm not too bothered if my education's affected, because in the grand scheme of things it's not that important right now. I think people's health and people who are immunocompromised and elderly, they should be put first right now, and if that means that medical students are pushed to the side for a bit, then that's fine. There's also been talk of final year medical students being like drafted into hospitals to take pressure off of doctors. That might sound really shocking to a lot of people, but the final years at my university have basically finished. They don't really, as far as I'm aware, have much stuff left to complete. So the people asking me if I'm going to get drafted, no, I'm not going to get drafted. I'm just in 4th year, so I'm incapable. Yesterday, sort of the last day before things went a bit crazy, I was in a respiratory clinic. There were people coming in with really quite bad lungs who were scared about the coronavirus, and for people like that, it must be so horrible to just hear every day like, you are more at risk of death if you are this old, or if you have underlying conditions. Like, that's just not nice to hear. I think it's really important for us to just be kind to everyone, as we should always be, but to continue and just look out for people, especially your elderly relatives or anyone who might be more at risk, and just be kind. I think if everyone was kind, just things would be a lot nicer. Also, if you stop touching your face, you might get less acne as well. That is my public health message. Okay, I just got multiple emails. So my teaching on Monday is cancelled because the doctor is involved in a COVID-19 planning meeting. And I also have an email from the gym which says that they are reviewing their opening and closing times, etc. So I don't know. I guess it's good that things are starting to like close down. I think what I'll do is I'll just vlog if there's any updates, if my med school gets closed, if it's still going ahead. I'm also hearing rumours from other students that people in our year might have coronavirus. Honestly, I wouldn't be surprised because we have placements in A&E and we have night shifts. It wouldn't be that hard for something to be transmitted if you didn't know someone had coronavirus, then you went to speak to them and then they coughed and it went on you. I don't know. The more I speak about it, the more I think placements should just be cancelled because it's not really safe or that useful for us to be there. But let's just see. I'm going to keep you guys updated. Please take care of yourselves. Okay, this is such a random video, but someone just DM'd me. They were very polite, but they were like, all the other NHS staff have to keep going in. Basically, like, why do you guys get to be an exception? And I thought it was quite a good point. And there's a few reasons. Firstly, we're not paid anything. We still pay for university, and obviously it's scary for them, I understand that, but they've also been trained in how to respond to things like this, and they're qualified. That's another important point. Medical students do not have a medical degree. We're also not trained in individual hospital protocols on how to respond to things like this. So we're not qualified, we're not adequately trained, and we're also not paid. I hope I don't sound like angry. I'm not angry. I just think it's quite a good point, and maybe you guys were thinking like, oh, how come you guys don't have to go in? But that's why. So I guess in a way, I'm actually quite lucky. I wouldn't say lucky, but I guess it's like quite a privilege to be able to choose or be able to have the option not to go into the hospital. More random thoughts. I don't know, this video is such a mess. Okay guys, it's only been a few hours since the last part of the video, but I just got an email saying that from 5 PM today, all of the medical students will be withdrawn from clinical placements until the 1st of May. And I feel like if things haven't got better by then, it's just gonna be extended. So all of my stuff is cancelled. I think they might try to do some tutorials or like, I don't know, deliver some online material, but they haven't said yet. At the end of the email though, it says that senior medical students may wish to offer their services during this time to the local trusts. And we can do things like fill gaps, support foundation doctors, carry out tasks and procedures within their skill set. This honestly just sounds like there's a war or something. Would I volunteer? I don't know, maybe? I guess I'll read the extra information. I found this mask that I was given in summer in China. So now it seems like it's fitting to open this. Mask unboxing. I look scary. I remember wearing masks, I hate them, they're so uncomfortable. This is the wrong way around, this is literally the wrong way around. Okay, so I look a bit like an egg. But today's Tuesday, it's been a few days since the last part of the video. I have left my house about twice to get food. Still waiting to hear back from my medical school in terms of what they're planning on doing. I'm also realizing that I'm in quite a lucky position that I can sort of comfortably self-isolate and not worry too much about you know, not going to work and not having an income. But whilst I've been at home, I've been trying to clean it up. My room looks the cleanest it's ever looked. We've got the bed with the banana pillow, ignore that mess. And then here is the mirror with a new light behind that I got from IKEA. And then the desk is so clean. It is so clean. Oh my god, look at that. That just looks so nice. My room never looks like this. I took a good 4 days off of studying and just relaxed. So today I'm trying to get back into it. I'm still gonna study because I do think we'll have some type of exams. I need to learn this material anyway. I can't just not learn about the lungs and become a doctor. I'm gonna do a video on this at some point, but I make my notes on Notability now. This is really hard to scroll. I've been to the supermarket twice, and on both times all the meat was gone, all of the toilet paper was gone. Okay, so I've just got the email from the med school. I don't really want to read this, but thank you for your understanding. So current placement-based teaching is expected to be disrupted until at least the 1st of May. The Year 4 team is developing a timetable of alternative teaching activities which will be conducted through the online platform. Your written exams will take place at the arranged date in July, so that is normal. These will be conducted in the usual manner if UCL is open, or online if it is not. If delivered online, these will be conducted via an app on your UCL medical school iPad. I don't know how it would work. It's definitely a very strange way to do things, but I don't really see what else they can do. By the sounds of it, they're still going to try and deliver all the material online, and our written exams will cover all the material for the year, even if we haven't had face-to-face teaching for a whole term. We currently anticipate that OSCEs will take place on the previously agreed date in July. OSCEs are practical exams. You have different stations and you go around in a circuit. I don't really know. My hair is really annoying me. I think it's safe to say that no one really expected things to like change as quickly. But I think I literally need no sympathy right now. Like, I am in such a privileged position, like not working on the front lines, not being vulnerable. So I really have nothing to complain about. I think we just need to be kind to one another, look out for people, especially vulnerable people. One thing about not going outside is that I don't even make myself presentable. I just leave my hair like this literal mop, just like an egg. Take care. I will see you in the next video. Bye bye, guys.
That just as you don't know how you manage to be conscious,